This is Professor Michael Chapman. I'm one of the most experienced IVF doctors in Australia. I believe that an important part that I can contribute is to educate patients in relation to fertility, infertility, and all that involves. These series of podcasts help to educate you. I hope they are helpful to you. If you wish to know more, however, I'm more than happy to have you contact me via email, which is profmchapman@gmail.com, or make an appointment to see me on 9138 4222.
There are a couple of topics that are quite popular on the podcast. Do you think it would be useful for Natalie to share her thoughts on those topics?
Go.
I was just thinking mainly the most popular topics are around pregnancy in older women who are looking to, freeze embryos or, later in life, how Natalie approaches that. And the other question I had actually was, I think, Prof, you mentioned that Natalie had a number that you were going to put on the page. Did you mean on this page or did you mean on the IVF journey page? If it's this page, then maybe Natalie can call it out and I'll type it into the chat.
Yeah, do that now.
Yeah.
People watching and watching the video later can see it.
So the best contact number to get any kind of support or phone consult or in-person consult would be 0408 036 711.
Okay, 0408 036 711.
Yep, that's correct.
In here, and I'll just say Natalie. It's just in the chat, but I'm sure people will hear the audio recording and they might contact you through there as well.
Yeah, absolutely happy for patients to contact me.
And is it okay for them to just call or should they SMS first or something?
Depends on the time. 9 times out of 10, I will answer straight away. If I don't get through, always best just to send me a text message or let me know a convenient time that I should give them a call back, so I'm not calling whilst they're in the middle of work or perhaps in a meeting.
What a fantastic service.
Perfect.
So the question that's been raised, and as I said, I see a lot of older patients. For some reason, people see me as a miracle worker. But and it's not true. I try.
Need to give yourself more credit.
I agree.
No. I do my best. When a woman comes and she's had 2 or 3 cycles and she's 43 years old and she wants someone to give her more guidance about what to do next, not just push on and do cycle after cycle. What are your comments to her?
I think often I think it's almost like going back to basics, right? So sometimes what you can often find is that maybe a patient hasn't necessarily had quite a comprehensive workup initially prior to starting treatment. So I think it's always quite valuable going back and looking at all of their initial investigations, perhaps, when they might have actually had those initial investigations done, perhaps maybe they've had an AMH level, or an antral follicle count perhaps a couple of years ago, and whether they're worth actually repeating again. And I'll also we kind of touched on it a little bit earlier before, is looking at sort of those inflammatory markers as well to see if that's potentially having an impact as well. So I think that's really important to kind of go through. One of the pieces that we do look at when a patient is potentially considering a second opinion as well is really thoroughly going through the cycles, perhaps, looking at those treatment protocols that they initially had, what medication dosage they had, how they were responding to the treatment in terms of their hormone levels, how many follicles, how many mature eggs were collected, potentially what insemination method worked best for them, and then how many blastocysts that they actually had that reached to day 5. I think what Prof touched on, which was quite important as well, is, sometimes patients will go through multiple treatment cycles and they haven't actually been discussed in doing PGT-A or PGT-M based on their history as well. So having that sort of genetic testing insight is often quite valuable too. I don't tend to overstep too much, but I just look at potential avenues or potential sort of treatment protocols that we could look at just to kind of create that better success outcome as well. So I think those are sort of things that I would look at, and then give them the correct sort of information to help guide them in perhaps, you know, what they're thinking from a second opinion, and what matters the most to them in their treatment and what they want to achieve as well.
And don't forget that you can access all the previous episodes by going to our website www.theivfjourney.com and select IVF Journey Podcast from the navigation menu.